If you'd like to skip to a topic, please use the timestamps in the description. The Drug Classroom is exclusively funded by donations. If you'd like to support, please visit patreon.com/thedrugclassroom. Do you know about any research being done for people to safely take MDMA for therapy purposes? There's quite a lot of research taking place, especially for PTSD. Much of the work is coming from MAPS, so if you want to support them, I encourage you to visit maps.org. A few papers have already come out showing MDMA-assisted psychotherapy can help people who've been resistant to other treatments. Some of the patients who've responded well have had PTSD for more than a decade. This kind of drug therapy, although it doesn't work for everyone, seems to have a high level of efficacy. It's pretty unique given MDMA is usually just provided 2 to 3 times, yet the benefits can persist for years. It's also being looked at for other conditions, such as social anxiety in adults with autism. I'll be covering the MDMA for PTSD research in an upcoming video. SSRIs are crap. Or maybe we can take a view that's a bit more balanced. SSRIs are being used by a large number of people who ideally would not be on them. However, they're also being used by a lot of people who greatly benefit from their activity. Not everyone with symptoms of depression needs medication, and not everyone with depression will respond to the same medications. Yet that doesn't negate the fact that SSRIs are useful tools. In my ideal world, people with depression would first be assisted by non-drug psychotherapy. From there, they'd have access to a range of non-daily treatments like psychedelic therapy and ketamine. Other possible factors like dietary changes, meditation, and exercise would also be considered. And for those who don't respond well to some of the aforementioned treatments, other antidepressants, including SSRIs, would be available. I'm not thrilled with the current system, but I see no reason to claim SSRIs are crap. What are the dangers of 25I-NBOMe? More fatalities have come from 25I-NBOMe than the majority of psychedelics. Even though it's now illegal in some places, it continues to pop up, which is concerning. As far as we can tell, 25I comes with a few notable risks, including seizures, rhabdomyolysis, and significant vasoconstriction. People have seemingly died from being exposed to doses that were too high. This has come from using the drug intranasally, taking more than one blotter, and by using blotters that were improperly dosed. There's probably a dose level at which the vast majority of people won't die, yet we don't know what that dose is. Most traditional psychedelics, and even a lot of research chemical psychedelics, are safer to experiment with. Do you think it's wise to trust mainstream test kits for pills as opposed to powders for ecstasy and 2CB tablets? By scraping off a small amount of powder, you'll be able to test tablets with reagent tests. The same limitations of reagents apply, but whether you have a powder, tablet, or blotter, testing liquids should pretty much always be used. I recommend viewing my drug checking video for more information. Have you tried any drugs? I think a lot of people are under the impression that I don't use drugs, since the channel is primarily an objective resource. However, I do indeed use some of these substances. I've considered posting drug-related opinion and experience videos on another channel, but I haven't made a decision yet. Compared to some other people, I'm not exactly a great storyteller, so I'm not sure how interesting most of the experiences would be. Regardless, I have taken a couple dozen drugs. I haven't personally used everything that's discussed on the channel, but that's largely just due to a lack of time. It is rare for me to continue taking almost any drug. Most of my use is in the form of experimentation, since I like to have a personal understanding of the way various drugs work. As always, if you have any questions for a future Q&A video, you can leave them in the comments or send me an email. The Drug Classroom is exclusively funded by donations. If you'd like to support, please visit patreon.com/thedrugclassroom.